Today I'm going to show you how to properly obtain a blood glucose measurement on a diabetic patient and administer the insulin on the physician's orders for this patient. First and foremost, I'm going to introduce myself to the patient. I did perform hand hygiene upon entry into his room, and I'm just going to explain to him the procedures. Basically what I'm going to do is get the blood glucose level first. And then once I'm done, I'm going to step out the room, compare the MAR and the physician's order, make sure everything matches up, and then I'm going to drop insulin and verify with another nurse to make sure that the insulin is the correct dosage. Okay? So I'm going to introduce myself to Mr. Olaf real fast. Hi, Mr. Olaf. My name is Alexa. I'm going to be the nurse taking care of you today. Lunch is coming up, so we just want to make sure that we get a blood glucose measurement on you. And once we're done, I will get your insulin if you need any. And do you have any questions or anything about the procedure? Okay, great. So like I said, I did perform hand hygiene upon entering the room, so I'm going to don on some gloves. All right, and Mr. Olaf, can I get you to verify your name and date of birth? I'm just going to check the bracelet to compare. All right, great, everything matches up. And now, Mr. Olaf, I'm going to get you to go wash your hands real fast while I set up all my materials to get your blood glucose. This here is the monitor to measure the blood glucose. I'm just going to insert one of these strips that we add the drop of blood onto, and that will turn on the monitor. And then, sorry, my glasses were slipping. I also loaded a clean lancet into this machine that is going to stick the patient. And I also have an alcohol swab here to where we can clean the site of injection, and some gauze for any blood or leftover blood. So, Mr. Olaf, your hands are now all clean. I'm just going to look at your fingers. And do you have a preference on which finger you'd like me to stick? Okay, great. And so when we go to stick the finger, we want to be sure to use the lateral distal pad of the finger to get the blood. We're going to get a little alcohol swab and just clean off the area real good. Make sure to have some friction whenever you're rubbing, just to rid the finger of any kind of bacteria that might be still on there after washing his hands. All right, and we're going to let this dry completely before we stick. So we're just going to, all right. And then I'm just going to get everything ready over here while we're waiting on that to dry. I'm going to load this up. All right. And being that I do not want to contaminate the part of the finger that I wiped with the alcohol swab, I'm going to just squeeze the finger just proximal to that area to where I push all the blood towards the tip, and it'll just be easier to obtain the blood measurement once I stick him. All right, Mr. Olaf, big stick, okay? Great, and so we're going to get a piece of gauze, wipe off the first drop of blood, so we have a clean drop that's not contaminated by the alcohol or anything like that. All right, and we obtained his blood glucose measurement. Just be sure to give him some supplemental gauze just in case there is some extra blood that wasn't picked up by the strip there. All right, and it looks like his blood sugar is 180. And Mr. Olaf, what 180 means is it is a little elevated prior to eating, and we just want to give you some insulin based on the physician's orders before you have lunch, just so your sugar doesn't get too high. And while discussing this with Mr. Olaf, you want to check for, you want to perform a little focus assessment and check for different signs and symptoms, as well as a readiness to eat, because like I said, lunch is coming up, and we don't want him to not have any readiness to eat when his blood sugar is 180 and we're about to give him insulin to drop it low. So we want to make sure that he has some kind of readiness and he doesn't get the insulin on an empty stomach. And in regards to the signs and symptoms, you want to check for any signs of hypoglycemia or hyperglycemia both before and after the insulin administration, just to make sure that he looks okay. He looks great right now, but if you were to look for hyperglycemia, you would look for things like polyuria, polyphagia, and polydipsia, so he would be eating and drinking and urinating a lot, and potentially have small respirations, which would be more on the severe end. And then with hypoglycemia, you would see things like sweating and impaired coordination and confusion, things like that. So you want to be aware of that whenever you go to give the insulin. And so based on the physician's orders, we will draw up the correct amount of insulin. Now, I'm going to leave the room in order to check the MAR and the physician's orders and verify with another nurse. I will be right back, Mr. Olaf. I'm just going to prepare your insulin real fast. Do you have any questions or anything? Okay, great. I'll be right back, okay? So at this point, what I would do prior to doffing my gloves is get rid of the strip, properly dispose of that in the trash. I would disinfect the monitor with a cleaning wipe, as well as the strips if you're bringing them back onto the unit, as well as the sticking mechanism. And you just want to be sure to get the lancet out of here and dispose of it in the sharps as well on your way out. And then just dispose of your alcohol swab in the trash, doff your gloves, and then perform hand hygiene. And then we'll head out the room. I'm going to perform my hand hygiene. Okay, hand hygiene was performed, and now I'm outside the patient's room. I'm just going to compare the MAR to the physician's orders and enter in and document the blood glucose just to make sure that everything is right and ready on track to give him the medication that he needs. So I'm going to get the insulin vials. And on the MAR and the physician's orders, it states that I have to give the patient 20 units of regular insulin as well as 20 units of the NPH or intermediate acting insulin together, so 40 units total, sub-Q to whichever injection site that he, I guess, picks out or that he hasn't had touched yet today or within the past 24 hours. So what I'm going to do first is, since I have the insulin vials, before I touch it too much or draw it up, I'm just going to perform some hand hygiene and then put on some gloves. Okay, I performed my hand hygiene. And now I'm going to don on some gloves because the materials that I'm going to use, I don't want to contaminate the syringe nor the medication that's going to go into the patient. So I want to make sure I have clean hands. All right. All right, and here you'll see that the regular insulin is a clear color liquid, and then the long-acting insulin is a cloudy liquid. And we're going to draw this up in the same syringe, so this is going to be kind of important when doing so. You're also going to get an insulin syringe that is specific with the measurable units on it. And then you're also going to obtain an alcohol swab. And the first thing that we're going to do is we're going to roll these vials just to get the insulin all mixed up. All right. These are nice and mixed. And the very next thing we're going to do is just wipe the tops of these with a little alcohol swab before we put the needle tip in there. And this is all for infection control. All right, and so the next thing we're going to do, like I said, we're going to get 20 units of insulin from each bottle. However, there is an order to do it because of the cloudiness of each liquid. We want to make sure that we know exactly how much insulin of each type that we're going to be putting in here. So, first things first, we are going to uncap the needle. All right, so the needle is uncapped, and what I'm going to do is I'm going to pull back 20 units of air. As you can see here, I know it's kind of difficult. And for this purpose, we're going to inject this air into the NPH first because it's going to be the second medication that we draw up. So I'm going to, in order, inject 20 units into the NPH without allowing the tip to touch the liquid solution. And then I'm going to drop another 20 units of air, inject into the regular, flip it up, draw the regular insulin first, NPH, and then I'll have 40 units total to administer to the patient. Okay, so this is 20 units of air, like I said, that I'm going to Inject into here. This is the cloudy NPH insulin. All right, 20. Draw up another 20. Go into the regular. Draw it up like so. All right, so that's 20 units of regular insulin. And then we're gonna draw up the 20 units, so 40 total of the intermediate acting insulin. And the very next thing we're gonna do is we're gonna safely recap this needle by sliding it into here and pressing the cap on. And I'm going to label the syringe and then verify with another nurse to make sure that it's the proper amount according to the MAR. All right? Miss Michelle, can you verify that this is 40 units of insulin, 20 of the NPH, and 20 of the regular based on the MAR for this patient, Mr. Olaf Michel? All right, great. So everything's ready to go. The very last thing is just taking off my gloves and then going into the room to administer the insulin. Okay, prior to entering the room, I did perform hand hygiene and I put on some gloves. All right, Mr. Olaf, based on your blood sugar level, we are going to have to give you 20 units of regular insulin and 20 units of a longer lasting insulin together. Where did you last receive your previous insulin injection? Okay, it was in your left abdomen? Okay, great. So there's numerous sites that you could actually take for injecting insulin. A lot of people do it on the back of the arms. You could also do it in the abdomen as well as the thigh. And depending on how much adipose tissue or subcutaneous tissue that they have beneath the skin, if you can pull it or pinch it and it has 2 inches of wiggle room, you can inject it at a 90-degree angle. If it has just about 1 inch, you could do 45-degree angle to inject the insulin, just to make sure that you get it in the right type of tissue. So, like Mr. Olaf said, he did his left abdomen last, so we're going to rotate to the right side, and we're just going to get an alcohol swab and wipe in a circular motion here. Be sure to, like I said, do friction just to rid the area of any kind of bacteria that might be there. All right, and we're going to allow that to dry completely while we get the syringe. And it is labeled and all drawn up. And Mr. Olaf, prior to administering the insulin, I just want to verify one more time your name and date of birth. Can you verify it for me? Great. Okay, so now the site is completely dry. I'm going to take off the insulin cap, and then I'm going to pinch around the area that I had wiped with the alcohol swab, and then I'm going to pinch like this, and we're going to let him know when we're going to stick, and we're going to administer the medication slowly. All right, Mr. Olaf, and also important whenever you're going to inject insulin, you want to make sure to keep your fingers kind of like a dart on the hub part and not the plunger, because if you did it like this, you might actually make the insulin go out prior to getting in the subcutaneous tissue. So I'm going to hold it like this, and then I'll put my finger in the plunger once I get it in the skin. Okay. Mr. Olaf, big stick, okay? All right. And then you're going to put this in the orange cap here. Give him some gauze just in case of any kind of bleeding or leaking. And then the very next thing you're going to do is make sure that cap's on there and safely dispose of the needle. And once I'm done that, I'm going to doff my gloves, perform more hand hygiene, and document that the medication was given to the patient. And that'll be it.